Hello, everyone, and welcome. Thank you for joining us today. My name is Jen Rose Fitzgerald. I use she, her pronouns, and I am the program coordinator for the Training and Education Initiatives at the Social Policy Institute, which is located at Washington University in St. Louis. Today's event is part of an initiative called Data Science for Social Impact. And this initiative is focused on building capacity and also facilitating dialogue, building community among social sector organizations who are thinking about how to be more intentional and impactful with data. And more specifically, organizations that are grappling with ways to use data to increase impact for and with the communities they serve. So today's presentation is a great example of how Generate Health is grappling with these questions in their work. Generate Health's mission is to mobilize and inspire the St. Louis region to advance racial equity in pregnancy outcomes, family well-being, and community health. Sarah Kennedy is a senior manager in epidemiology and evaluation, and in this role, I know she thinks a lot about data and social impact, specifically thinking about addressing racial disparities in infant and maternal health. So I'm going to turn things over to Sarah for now and let her share her screen and her insights on elevating community voice and data collaboration.
Good morning, everyone. I will be sharing a presentation, but I'm going to start the presentation off with asking you all to participate a little bit. So I'm going to switch screens. So what I would like to know from you all is what identities are you bringing to the space today? And I have included the Menti link as well. So if you guys could go to menti.com and then use the code that is at the top of the screen, or I think the link might take you straight there. You all a few more minutes, but we've got St. Louisan, graduate student, recovering academic, data nerd, queer, artist, fake academic, woman, researcher, sociologist, trauma history, formerly educated, cisgendered, daughter, artist. It's really hard when they move to see which ones are new. But yeah, so we all bring a lot of identities into the space that we are working in. And so this is how we started out our community data sessions, is really getting a grounding for who was in the space and who was in the room, just so we could kind of get to know each other, find common ground with one another. Okay, I'm going to exit out of this. Cool, it's on my second screen. So for today, I'm going to talk about the community data sessions that we did at Generate Health. So we have been working on these sessions for about a year, but really heavily over the past few months. We have had a handful of practicum students that have helped us at various stages. And so I want to recognize that the practicum students have done the majority of the work on this project. So we have Michaela Fry, Hannah Aaron, Tiani Spence, and Allie Pinson. So Generate Health mobilizes and inspires the St. Louis region to advance racial equity and pregnancy outcomes and family well-being and community health. So this project was part of the Flourish Initiative, which is the infant mortality reduction initiative at Generate Health. So Flourish's North Star is to eliminate racial disparities and infant mortality by 2033. So we do this by working to align providers, researchers, advocates, policymakers, community members, etc., to support the Flourish community priorities by illuminating the root causes of racial disparities in infant mortality and maternal health, advocating for the redirection of resources to eliminate racial disparities in infant mortality and maternal health, catalyzing action within the ecosystem, and advancing regional accountability for equitable systems. So at Generate Health, we are really trying to shift power to the community. So we know that many BIPOC communities are over-researched and underappreciated. And in an age where community participation is an important part of data validity, historic power dynamics between community members, community organizations, researchers, and funders are perpetuating BIPOC exploitation and research. So shifting the power from funders and researchers to community members and organizations is an important path forward to realize ethical and community informed data. So Generate Health strives to produce user-friendly ways for the community to interact with maternal and infant data in the St. Louis region. So the purpose of this project was to develop community data tools that can be used by various audiences to have conversations about infant mortality, as well as to help Flourish partners contextualize their roles in reducing racial disparities in infant mortality, and to really transform the narrative around infant mortality in St. Louis. So Generate Health set out to create a series of infographics, a story map, and an interactive dashboard for the region. We developed a process to involve the community in developing these public data pieces to tell the story of infant and maternal health in the St. Louis region. The process included planning the interactive virtual sessions, collecting data through various activities included in the virtual sessions, analyzing of qualitative data that were collected, creating the visualizations and telling the story of maternal and infant health in the region, soliciting final feedback and revisions on the products from those that attended the community data session, and finally, dissemination of the products across the region. So this process will be repeated in order to update the products on a regular basis. So Flourish is led by the Community Leaders Cabinet. The Community Leaders Cabinet previously determined the priority areas for the Flourish Initiative. These priority areas became the topics for the data tools. So we began by researching publicly available data for each of the topic areas. Additionally, we researched best practices for virtual engagement. Additionally, we wanted to intentionally include elements of each of these into the planning sessions. So trauma awareness principles. So we want, when determining the prompt questions for the breakout sessions, we know that infant mortality work involves various trauma experiences, and we did not want to unintentionally trigger individuals. Health equity was considered through the process from the recruitment strategies through follow-up with the community leaders. Common language. So these sessions included a variety of perspectives and experiences. It was important to begin each session with a list of common words and definitions. So this allowed everyone to be on the same page when interacting with one another. And then accessibility. So individuals may not be connecting via computers, but rather their phones, which often make it difficult to jump back and forth between various platforms needed for interaction. Oops. So Generate Health is intentional about providing community supports for its participants. In a virtual environment, we scheduled sessions at times that are convenient for our community members. We offered a stipend for individuals, and we were very flexible with technology and how people interacted with the sessions. For remote payment, we offered 3 options. So direct deposit, Venmo, or Chime. So if you guys are interested in those sort of details of logistically, how did this work? Just let me know and I can give you more of a rundown. So as you plan the community data sessions, it's important to be intentional about facilitation throughout the session. So we wanted to determine staff roles and responsibilities throughout the sessions and consider and what we did was we assigned someone to be various roles. So someone was the technology host, someone managed the chat box. People were assigned as breakout room facilitators and note takers, etc. And we outlined all this information in a detailed agenda. And the detailed agenda is also useful to include things such as the timing of each item and the activities instructions. So other aids in facilitation included ground rules, technology guidelines, and common definitions. We began each session going over these items to ensure that everyone was on the same page. And so here are the ground rules that we generally use at Generate Health. So here was the guidelines we used in regards to technology. We explained the platform that we were going to use, the options for participation, and demonstrated how to use things. So this will be specific to each individual session and what you decide to use. So common definitions were also an important way to ground everyone in the conversation. So we had people participating with various perspectives, and we wanted everyone to be able to communicate with one another effectively. So there are a variety of platforms that allow virtual collaboration and interaction. So these are just a few of the platforms that are available. As we continue into the pandemic, more and more interactive platforms are popping up. So we tried to use activities that did not require a login or a password. Oops. Additionally, we limited the number of different platforms that we used in order to accommodate individuals who are participating on their phone. So it's, like I said before, it's often hard to jump back and forth on your phone from Zoom to various platforms. If you all know of any additional platforms that have helped with interaction in meetings, how about you pop them in the chat so we all know what's out there? And so I'm going to ask you all to start participating. So we did a 5 whys activity at each of our community data sessions. And so what I want to throw out to you all is Brittany, a Black mom in St. Louis, did not make it to her prenatal care appointment. Why? So either bring yourself off mute or pop it in the chat. She did not have a ride. Why? Her work schedule. Why? Her other kid got sick. She didn't have paid time off. I'm going to ask one more why. Typically in our sessions, we would get to part-time work, bad experience with provider. Cool. So typically in our sessions, the last why would be somewhere along the lines of racism. And so really what a 5Y activity does is it peels back the layers and eventually gets you down to the root causes of why something didn't happen. Okay. We also used a variety of visualizations. In the data sessions, we broke out into small group sessions and breakout rooms. And so I am going to ask you guys to look at this visual and the question of why do you believe, or what do you believe has contributed to the disparity in the fetal death and infant mortality rates between Black and white people in St. Louis? What happened in 2018 where rates got closer, but then in 2019, rates got farther apart? Lack of quality and accessible healthcare. Right, that is definitely something that has happened. Yes, this was a breakout discussion. Environmental concerns in Black neighborhoods. So really, we just had the group talk with one another to kind of explain what was going on in the visual. So here is another visual that we used. So this one talks about childcare supply. So the brownish yellow color is where there are not enough childcare providers. And so our prompt question in the breakout was, what do you notice about the map? How do you think the map has changed over the past year as a result of COVID? So I'm going to toss this out to you all for like 30 seconds. Do you guys notice anything about the childcare map? Where is it more gold and brown? Rural. This is St. Louis, so rural would be out here. This right here is just South City. So this big rural area, South City. Low income communities, less official childcare. Okay. We also know that like childcare was something that was affected by the pandemic as well. Even less access to childcare in low income areas. And high density areas. Yeah. Okay. Here is a third visual. So this one's a little bit more simple. So in St. Louis, Black moms are at higher risk for depression and stress during and after pregnancy. So 1 in 7 women experience depression and anxiety during and after pregnancy. So the discussion question here is, what perinatal behavioral health services are needed or need to be improved in the St. Louis community? So we asked the group to discuss that. We also had a poll everywhere. So this over here, we had a poll everywhere. It's not live, but how would you describe current access to screening for perinatal behavioral health services in St. Louis? So then people could vote little access, easy access, unsure. What we ended up doing was, instead of using externally poll everywhere, we just used the Zoom poll. I don't know off the top of my head how many mothers were, or how many women were single mothers. The fourth visualization is around transportation. Yes, these slides can be shared. So we showed this visual on the left, and then the discussion question was, how does the lack of reliable transportation affect the lives of Black pregnant and parenting families in St. Louis? So we had a discussion around that. One other thing that we did was some rank voting. So we found all these different metrics that are publicly available, and we asked the group to identify which of the metrics they felt were most important to highlight in our data tools. And so they did some rank voting. In Zoom, you can do like check all that apply, and you can ask individuals to only choose 4 and trust that they only choose 4. Or I know that like SurveyMonkey has it where you can do rank voting, and you can choose like what's your top 1, 2, 3, 4. So a few options there. So after we collected all this data, we have started to build the data stories. So the qualitative analysis of recordings, staff notes, small group and breakout session notes, chat box notes, polling results, we pulled it all together. We also did some crossover of topics between the data sessions. So when doing visual storytelling, we thought about, these were just some questions that we grappled with. So what stats should be highlighted? What quotes are inspiring? What visuals represent the ideas? And what story needs to be told? These are just some of the various platforms that we've used when thinking about visual storytelling. I had the practicum students start on Pinterest to get ideas about what the visuals would look like. So they looked at Pinterest for infographics and got some ideas of how the infographics could be laid out. I believe they also had examples of dashboards. We had pulled together some examples of dashboards in other communities. Canva makes it really easy to make things look nice. So they did all the infographics in Canva. Tableau is good for the dashboard. NVO is qualitative analysis, and then ArcGIS is for the story map and mapping. So here are examples of some of the infographics that have been created from this project. The full series will be available on the Flourish website by the end of the year. But this is kind of sneak peek of what they look like. We do not have the story map done, so I just pulled examples of story maps. So a story map is a series of maps that tells a story alongside. And so we are in the process of building the maps and writing the story. Dashboard. So this is one of the examples of dashboards that we're looking at. This one actually comes from California. And so there's these drop-down menus that you can pick and choose, and then the data adjust accordingly. And so this is one of the things we're looking at for our dashboard. And so we hope to have all of these different pieces pulled together by November 2nd. And so we're going to have a soft launch event with the community members that participated in the data sessions. So this would offer them an opportunity to give feedback on the visualizations that were developed from these sessions. And then once the data tools are complete, Generate Health will use a variety of outlets to disseminate the data tools. So this will include the Flourish website, Generate Health eBlast, and then most importantly, we will be making available all of this to our community members. Updating the tools, we'll either want to do it annually or every other year. We are hoping for future in-person sessions, which would allow things such as like a data gallery walk, dot voting, sticky note comments, various things. And so challenges, as all projects, this came with its own set of challenges. So our biggest challenge has been COVID-19 and the shift from in-person sessions to virtual sessions. This also affected the timeline and it's affected the timeline and then the technology. So there's been a learning curve about how to interact with individuals virtually and various platforms for interaction, computer versus phone, unstable internet connection of everyone. We've had facilitators with unstable internet connection that drop off in the middle of their facilitation. So, I mean, it's just been the whole gamut of things. So here are additional resources. You guys will be getting the slides, but I will also send out the building community data session or data guide that we put together for this project. That's all I got.
Thank you so much, Sarah.
Yeah. So there's one question in here of, is there a plan for how the community leaders, oh wait, hold on. There was one above that. Okay. Would it be possible to show the progressions? What was developed by staff prior to input, project after participant input, and then final posting? So I'm not sure if we really want to share all of our slides from the various community data sessions, but what we did, so you guys have some examples in this slide deck, but so we hosted 5 different sessions. And so each of those sessions had its own set of slides and visuals that were put together prior, and then the visualizations will be public hopefully by the end of the year as the final. Let me think about a way to show that.
And Sarah, I had a question too that sort of builds on JC's question, both about like the sessions and the input, but then how can you show or display the input as sort of an important data point as people think about transportation barriers or clinic access, right? So I think this is fantastic, and having folks, react to, data points in other ways in a way that's very, very accessible. But I'm also interested in, community voice as being elevated as a critical data point. And so I think just kind of pushing on what that feedback loop looks like a little bit more. And you may want to also speak about some of Generate Health's other work with the Community Leaders Cabinet and otherwise that also elevates that voice.
Yeah. And then is there a plan for how the community leaders will advocate and disseminate the information? Yeah, this all goes together. So we at Generate Health have the Community Leaders Cabinet, and that is a cabinet of, I think, about 35 community leaders in the region. And this is actually our second cohort. And that Community Leaders Cabinet is in charge of determining the priorities for the region in terms of infant mortality, what we should focus on. They also help with the policy priorities and defining what those are. They have done various activities to advocate for different policies that help Black pregnant and parenting families in the region. Try and think. They make decisions about investments in infant mortality as well. So really we tap on the Community Leaders Cabinet for a lot of key decisions related to infant mortality. I'm trying to see if there's others on the call from Generate Health that can speak to the Community Leaders Cabinet. Leah was supposed to be on, so I was going to put her on the spot. Okay, another question. Are there specific goals or numbers for the community to reach? The overall goal is 0 racial disparities in infant mortality by 2033. And so that's in alignment with Ford through Ferguson's 2039 goal. We believe that the community will need to take care of its moms and babies before racial disparities are eliminated in the entire region. We see infant mortality as like a leading indicator.
And then I think as part of that, Sarah, are there like participation goals that you're trying to make sure that you're, amplifying representative voice as a part of this? Like, how do you weigh the sort of like quantitative number of like how big the problem is, like in relationship to the number of folks that you're reaching through the Community Leaders Cabinet or sessions like this?
We haven't thought that in depth.
These are big questions.
Yes, that's why we use the word grappling. We're all sort of grappling with how to do these things well. And I really appreciate your sharing. There's a question in there, who has the accountability? Feel free to bring yourself off mute and elaborate on that question, Jennifer, if you would like to or not.
Yeah, sure. Yeah, great presentation. Really helpful and insightful. I think a lot of times there, at least for community engagement initiatives, the community becomes aware. However, I think it's important to identify perhaps maybe who those, departments or people are who have the oversight, so that, the community knows who to advocate to when things aren't going well or when they are going well. So I think that's kind of important to put like a face or a name to, what the problem is for the improvement.
Yeah. And like just thinking, so Generate Health has a lot of stuff going on. Yesterday, we actually launched what we're calling, I think, the legislative report cards. So what we did was we looked at elected officials in the St. Louis region and looked at their voting records. What are they filing for? What are they voting for? What are they not voting for? And really gave a grade essentially to our elected officials as to whether or not they are supporting policies to advance the elimination of racial disparities in maternal and infant health. So that is on the Generate Health website. I can probably find that link before we're done here. But I think that's one cool thing that we did and launched it yesterday. So
Timing is everything. Any other questions out there? Feel free to bring yourselves off mute.
Sorry, I'm just asking a million questions. But Sarah, I know you mentioned in one of the barriers funding, and I am curious, and I know probably a lot of other folks on the call are thinking about like, this sounds great. Like, how am I going to find the resources to do it? So I wonder if you can speak a little bit more on like case making to do this level of engagement and like what's resonating or what's not resonating, or, you know, for folks on the call who are a little bit more in a either funder space or kind of, you know, pushing on funder space, you know, what's it going to take to do this sort of work sustainably?
yeah, I mean, we were fortunate to get our funding through Missouri Foundation for Health. But I think slowly, from our experience in general, funders are getting a little bit more open to the idea of community engagement and what it takes. We have gotten grants to support community members in the work. And so in the non-virtual space, we would provide transportation. So that would either be a gift card or a Lyft ride to and from the meeting. We would provide childcare. We would provide food at the meeting. All the adults would receive a stipend for their attendance at the meeting. And so like we needed some sort of funding to support that. And we've been able to successfully find funds for that type of work. And so I think most of it has been very local and regional funders that have started to become open to like the funds can be used for stipends, the funds can be used for just various things.
Sarah, great presentation. And I'm really enjoying and appreciating the conversation and discussion. I was wondering if you could go a little bit back and if we could take you up on the offer to talk a little bit more about the stipend process that Generate Health led, both in terms of how how Generate Health determined amounts of stipends, and then of course with some like the electronic stipend transfer process. What feedback did you get from participants, either about the amounts or the process, any barriers?
Yeah, so for these sessions, we did $25 stipend for the 2-hour session, and then $45 for internet reimbursement. So we had it as a opt-in on our registration page. So people could opt in if they wanted to receive the stipend and the internet reimbursement. So then from there, we have a whole process outlined as to the different options, but we started Chime probably April of 2020. So we knew that we needed to find a way to get stipends out to community members. Some things to think about is not everyone's banked. So we needed an option that wasn't mailing cash because we didn't trust that. But then we couldn't rely on direct deposit just because not everyone's banked. So we found Chime, and Chime is essentially a debit card that can be used just like a debit card anywhere. And it can, what we do with it is we're able to load money remotely onto individuals' Chime cards. And so after people participate, then we load money onto the Chime card. I know that we offer direct deposit as well. So if we have people fill out a form that goes directly to Michelle, who is our office manager. And so she has policies in place for that banking information because direct deposit does require banking information. And so then she does the direct deposit. And then I think Venmo's our newest. And I think we probably have a business account as Venmo and just whoop, like send it over to people. And I mean, I think a lot of people have started to take us up on that, which I think is easier all around. If people have Venmo accounts, it just is a real easy transfer. So.
Any additional questions out there?
I am looking for the elected official report so I can share it.
I'm also curious if other folks on the call have examples or could give sort of a quick overview of how they may have done similar things in terms of like presenting findings and getting feedback on, like data that, folks consume all the time, but often do not go that extra step like Generate Health does and make sure that folks can, kind of see it and participate in it. So I'm curious if other folks have similar efforts or similar things, processes to share. As well as from the academic perspective, to Gretchen's point.
Feel free to.
This is Jennifer. I was going to say, I've done some advocacy for domestic violence, and we've taken, mapping and service gaps to the county commission and asked for dollars that way. And because, they've especially now with, ARPA funds and things like that, they're looking for places to give funding to, and many times they don't know where those gaps are because they're just pushing out the services. So perhaps that's an option to talk to, however, whether it's the city or the county, and present to some of those elected officials and or the staff, and see if there's an opportunity to present your findings and maybe put in like an appropriations request or something like that.
Yeah, one of our hopes in general is like, I think there's going to be something like 15 different infographics on a whole variety of topics. So if our advocacy person needs to go talk to someone about paid family leave, like she'll have a like something to give that elected official as a leave behind. And so that's kind of been our thought, is like, if we have all these tools available and different people can come and grab them for different reasons, then we all kind of start talking the same language together without really needing a super coordinated effort. Because previously, so one of the things that did spark this was there was a report that was created for St. Louis County in terms of maternal and child health. It was an academic report, and it was only St. Louis County. And the city had no desire to do a replicant version of it. And so like, we don't have good data that is St. Louis City and County combined. It's out there, you can get it, but it's not what is highlighted and shown.
Sounds like maybe there's an opportunity to have for a partnership between the cities and the county to you know, they can help one another instead of, you know, kick the can, point the finger.
Paul, you're shaking your head.
If only. Yeah, no, I mean, I think it's some of it is, how do you translate that intent? Because I think a lot of folks at the city and county want to work with each other, just find it difficult to do so. But I agree, it's another great opportunity, one of many.
Yeah, and the advantage of Generate Health is like we are removed from government. So, I mean, that kind of makes it a little easier for us to be nimble and do some things like this.
These are all really great questions. I don't know if anyone else has any questions they want to share, or Gretchen, you asked a question about academic perspective. I don't know if you would like to elaborate on that, what you have in mind there.
Sure, yeah. I am a new postdoc at WashU, and I work with integrating behavioral health and primary care services, and I'm also interested in health equity, and just kind of wondering if there's any opportunities to support the work that you guys are doing from an academic standpoint, in terms of lit reviews, or, you know, kind of the skills that academia can bring to policy work.
So with, you said behavioral health. So we do have the perinatal behavioral health initiative. And so that is kind of the bucket of work that I think we could explore a conversation with the other team members that lead that work to kind of see if they have needs or anything like that. We're always looking for partners, and kind of open to ideas that others may have.
Sounds great. I'll shoot you an email after this.
Okay. Here, I can put my email in here.
All great questions. Any last questions before we wrap up? There's still some time if you have any more questions for Sarah, or how will you achieve your goal date?
So, I mean, we've got a whole bunch of stuff going on. And are we going to achieve 2033? I mean, probably not, because that means solving racism in St. Louis. But I mean, we are doing a whole variety of things, and not just the data sessions. So we have the community leaders cabinet, input from early Head Start. Yes. I know they're involved in which piece, I don't know off the top of my head. I kind of think they sit on the community leaders cabinet in some way, shape, or form. But yeah, we have the Flourish Initiative, which is the infant mortality reduction initiative. We have the perinatal behavioral health initiative, home visitation collaborative, a safe sleep network of providers, all kinds of things going on. I'll leave our website.
And one more question in the chat. Are you partnering with a business community?
That is definitely one of those areas that I think there is room for improvement. We have a few people that we partner with in various ways, but not in anything substantial.
And Sarah, there's a question in the chat about, well, it's not a question, just love to find out more about Home Visitor Initiative. Can you share the best place for people to go to link into all of these? I do believe
Yeah.
you have them.
So here's Generate Health's website. Here's Flourish's website. On the Flourish website, there's a bar that says what we are doing. You can click on home visitation and that'll give you more information.
Thank you so much. And I just want to thank everyone for being here and for all of your great questions. And it sounds like some people are going to follow up with Sarah after the call, which is always a great sign. I wanted to share a couple of things before we go to let you know about a couple of other upcoming events. So we have the Data Science for Social Impact Initiative has a roundtable series coming up. And these are the dates. I'm going to plop in the chat our Eventbrite for that. And we hope you will join us for one or all of these events. These are just other spaces to continue conversations and grappling with thinking about data, how to utilize data for social impact in and with the communities. So I think that this topic is definitely relevant to the kinds of things people will be discussing at each of these roundtables. And I just want to say thank you so much, Sarah, for this presentation, for the work that you all are doing at Generate Health, and just thank you everyone for being a part of the conversation. Will you get invites for these other events? If we can send you a follow-up to this, that you can click on the link and register right now, but we can also send it in the follow-up email from this event. So thanks, everyone.